So here you can see that we have the spine, and you can see some of the important structures that we need to talk about. So you can see here we have the vertebrae. Each of these bones is a vertebrae, and we have 5 vertebrae for the lower spine called the lumbar spine. We have a section of fused vertebrae at the very bottom called the sacrum, also known as the tailbone. And then we have the pelvis, which attaches to the sacrum at the SI joint. And then the pelvis is the top half of the hip joint. And there are several muscles that attach to the pelvis and then attach to the thigh bone to create the hip muscles and movement at the hip joint. And we also have several muscles that attach to the spine and then down to the pelvis, or the spine, and then down to the leg bones or the thigh bones or the femurs. And those all help to create core stabilization, core control of motion. Those are the core muscles, the hip muscles. And all of those muscles are really important when we talk about strengthening the muscles that support the lumbar spine and the hips. So here you can see there's kind of an interesting shape of each of these vertebrae, and where the vertebrae connect one vertebrae to the next is called a facet joint. Those joints can sometimes be the source of pain. There are nerves. There's nerves that run down behind the vertebral bodies on the spinal column. And then those nerves exit the spine where there's this little hole. And the spine opens between the facet joints and the body of the vertebrae. There's a space for the nerve to exit the spine, and then those nerves come down and out and around to exit into the leg and innervate the muscles and the skin and the structures of the legs from the lumbar spine and the sacrum. You can see there's nerves that come out from the sacrum as well. So when we're talking about back pain, there are a few things that it's really important that you understand. The first is that it's not best practice to identify one structure of the spine and say, this is the problem structure and this is the source of your pain. The back is much more intricate and complicated. It's often multifactorial, the reason why we're having back pain, and we like to think about and consider, or it's important to consider, the biopsychosocial model of low back pain. All this is saying is that there's biology. Yes, there are facet joints that sometimes are the source of pain. Yes, there are nerves that exit the spine that are sometimes the source of pain. Yes, we have the SI joint, which can sometimes be the source of pain. We have discs between each vertebrae, and that can sometimes be problematic or contributing to symptoms. We have pain that can be referred up and down from the SI joint, from the space sometimes between the thoracic vertebrae where those bones transition to a different shape of the lumbar vertebrae. That can refer pain down towards the SI joint and the hips. We can get pain referred from the hip joint as well as the muscles of the hip joint. So oftentimes there's more than one thing happening, and I see that a lot in the clinic where the patient wants to know what is the source of the pain, and often it's multifactorial. So I think that's really important that you understand. So that's the biology portion of it. Biopsychosocial. So the psychology of it is that depending on where your psychology is at, if you're grieving the loss of a loved one, if you're in a wave of life where things are just feeling really hard and you're in more of a depressed state, that psychology is going to influence how you perceive what's going on in your body. Are you an athlete and your priority in your mind is that sport or that hobby, and that's where your awareness is? that's all going to influence your psychology and how you're processing or perceiving what is occurring in the body. Biopsychosocial. The social aspect of this is, have your friends had back pain before? Have your family members had back pain before? Did your parents, when you were growing up, experience back pain? And how did they process this? And how did they talk about this? How does your culture surrounding back pain or pain in general, how does your culture talk about pain and what's happening in the body? All of those things are going to influence how we experience what's going on in our body. And it's much more complicated than just, I have a disc bulge or I have arthritis in my spine. There's so much more going on. And I think that if you at least kind of take all of that into consideration, that's going to help you understand back pain a lot more deeply than a video that tells you that your pain is from your SI joint and here's one trick to do about it. So, with all of those things taken into consideration, let's talk about the biology or the anatomy of the spine. We have the SI joint, which is where the tailbone or the sacrum meets the pelvis, and that area where those bones meet is called the SI joint. There's a lot of ligamentous stability, meaning there's a lot of ligaments or structures that connect one bone to the next bone. There's a lot of ligaments there, and that motion at the SI joint is minimal. There's not a lot of motion that occurs there. Sometimes this can become the source of pain, and it can also refer pain to the spine as well as down the leg, and I'll put a chart of what that pain referral pattern looks like and where you could potentially be experiencing pain that might be referred from the SI joint. Same thing with the muscles of the hip. We have muscles that connect from the pelvis down to the thigh bone, and those muscles can sometimes refer pain down the leg, and I'll also include a chart to show you what that pain referral pattern looks like. Nerves that exit the spine like space. Nerves love space, movement, and blood supply. So if there is not enough space due to degenerative changes of the spine, where that space between the vertebrae is narrowing and narrowing, that space where the nerve exits is probably also narrowing and can irritate the nerves and reproduce symptoms down the leg. If you have a disc bulge, meaning a portion of the disc is pushing out and often is a chemical irritant to the nerve root that goes down the leg, that can also be the source of some pain and dysfunction. Some red flags to keep in mind: if you're having nerve damage or irritation of the nerve that has become severe enough that that nerve is no longer doing its job, what that will look like is often lancing pain, meaning a line of pain that you could probably trace with your finger that goes all the way down the leg. And it often results in numbness and tingling in the leg or foot, as well as decreased strength of the muscles that are innervated by those nerves. And I'll put a chart so you can see at L5, this muscle and this section of the skin is innervated by the nerve, at L4, L3, etc. Versus if there's irritation to a nerve, a bundle of those nerves, like the sciatic nerve that then runs down the backside of the leg, what muscles are innervated by that, what section of skin might be affected or feeling numbness or tingling, etc. So it's important that you understand that if there is nerve damage or irritation to the nerve to the point where you are losing strength or progressive loss of strength and function of the extremity that that nerve runs down into, whether it's the arm or the leg, that is worthy of a visit to the doctor's office. And you should be seen for that in a clinic where they can do an evaluation, maybe do some imaging, and make sure that you're not losing function of your body because of that irritation to the nerve. So keep that in mind. If you're having changes in bowel or bladder function associated with the onset of your back pain, also a reason to be seen by a doctor and be evaluated in in more detail so that we can make sure something more sinister isn't going on. So with all of those things in mind, taking into consideration that back pain is often complicated, that there are multifactorial reasons that people have back pain, including how well our brain is even able to process that space. We have a relatively small portion of the brain that is associated with the low back, and it's a big structure. So we don't really have good awareness in our brain of exactly what's going on in the spine. So it can be really hard for your brain to associate one spot as being problematic or painful. And you've probably experienced this where it feels like your whole back, it hurts here. Versus like when you cut your finger, we have a big space of the brain associated with this very small portion of the body. So we have a really good ability to say, ooh, it hurts right there. And that's really important to take into consideration when we're addressing back pain as well. There's some really important muscles that attach one vertebrae to the next, and those muscles are called the multifidi muscles, which you can plug into the search bar. And when those muscles contract, they will bend the spine, side bend, to the same side that the muscle is contracting, and or they will rotate away from that side. So if my multifidi muscles in my neck were to contract, they would side bend this way, or they would turn my head in the opposite direction. So the multifidi muscles are really important when it comes to stabilizing and kind of controlling one segment to the next, to the next, to the next. And controlling that motion is not only important that we have big, strong abdominal muscles, but those little muscles that attach vertebrae to vertebrae are also super important, that they work together with the big moving muscles in order to create optimal support of the spine and posture, as well as movement and control of that movement, which is a really big piece when it comes to managing back pain and alleviating back pain and symptoms. So those are the primary structures of the low back. Those are a couple things to be aware of that I think are really important to take into consideration if you're having back pain. And we will get into a few exercises and things to do for that, including the importance of the interconnectedness of the hip joint and the muscles of the hip joint, and how that influences the tailbone and the spine and the SI joint and low back pain, as well as the SI joint, a few things to consider for that, which you can plug into the search bar, as well as muscles of the abdominal region and the spine. Something else that's really important to take into consideration whenever we're talking about the spine is breathing. I think breathing is a super important variable to take into consideration with the spine. So if you're sitting in your chair right now and you take a deep breath in, you might feel how your spine lengthens. And then as you exhale, you might feel how the spine compresses. So by controlling that breath, you're actually changing what's going on at the spine. Some things to consider here too is there's a pressure system here in the abdomen where we have the diaphragm at the lower portion of the ribs, and it's kind of shaped like an umbrella. And then we have muscles in the pelvic floor, and those muscles are like an upside down umbrella. And those muscles should face one another. And when you breathe in, the pelvic floor should drop down as the diaphragm lowers on the inhale, and your lower ribs expand and your belly expands. And then when you breathe out, the diaphragm is going to come up towards the heart, and the pelvic floor should lift a little bit. And that movement back and forth between the diaphragm and the pelvic floor is what maintains what we call intra-abdominal pressure. And that pressure system, if you combine all of the abdominal muscles, the muscles of the spine, along the spine on the backside of the wall, and the top and the bottom of that cylinder, if all of those muscles are working together appropriately, you're going to maintain or control intra-abdominal pressure. And that pressure you can think of like inflating the tube of a bike tire. And that inflated air around the hard wheel of the bike tire, which would be the equivalent of the spine, is protecting the spine. So intra-abdominal pressure is controlled from the abdominal wall, as well as the top and the lid and the bottom floor of that cylinder. Those muscles all working together controls the pressure that supports the spine. So those are a few super important things to know and understand when it comes to the spine, the pelvis, and the hips. I think they're all interconnected, and I think that working on all of them at the same time, if you're having back pain, is super important. So when you look at the exercises for back pain, you'll understand why I have you doing hip exercises, as well as breathing exercises, as well as core strengthening exercises, as well as exercises that are going to activate and teach you to control the pelvic floor. So all of those things I think are super important when it comes to addressing and dealing with back pain. If you take all of that education into consideration, you'll understand yourself, you'll understand your spine, and it's a great way to bring awareness to the spine, awareness to the low back, which helps to increase the mapping in your brain and helps you to connect your brain to the low back and helps to heal and strengthen that connection of the brain to the body. And I think that when it comes to back pain, is a really important factor. So first thing, most important priority, bringing awareness to that part of the body and learning to pay attention to it, learning to observe it, learning to get curious, learning to be patient with it and work with it in a kind and gentle way. That's going to strengthen that brain-body connection and help heal.